Hi, my name is Dr. Jalpa and I'm the medical director and co-founder at Klarity Skin Clinic. Welcome back to my channel. Today I'm going to address a lot of queries that I often get around laser hair reduction. I will try and address the most commonly asked questions. So the most common question I get is how does it work? So laser hair reduction is basically targeting the bulb or the growing part of the hair follicle which contains melanocytes with a specific light, which is called as laser. The light has an affinity to pigment, and so only the hair follicles which are dark and thick usually do very well with laser. Finer, lighter hair which lacks pigment may not respond well to laser hair reduction. So, what the laser does is it hits the melanocytes, and the cells in the bulbs either slow down or stop growing, and that leads to a permanent reduction in hair growth. Second question that I get very often is the result permanent? So laser hair reduction is a permanent reduction. It's not a complete removal, but yes, the reduction is more or less permanent. The results may vary person to person and also body part to body part. So most people who do laser on the body would get similar kind of results as this. Of course, it depends on the hair type also, but the hair follicles on the body are not hormone dependent, and hence the result is more or less similar in expectation. The hair gets finer, lighter, less in number, the density reduces, and ultimately at the end of your treatment protocol, you will have very few fine hair on the body parts. Facial hair is a completely different ball game altogether. Facial hair in a woman or a young girl. These hair are hormonally triggered and stimulated, and the result would depend a lot on the hormonal status of the person. So conditions like PCOD, thyroid, which actually trigger hair growth on the lower face in a young woman, can can actually affect the results also. So laser hair reduction on the face in a woman or a girl should always be done under medical supervision and may need additional medical treatment uh, for the underlying cause. Third question, is it how different is it from waxing or threading? So waxing, shaving, threading, these are temporary methods that you do to remove the surface hair, or in case of waxing, even sorry. So waxing, threading, plucking, and shaving, these are temporary methods that you do to remove the hair. When the hair grows back, it grows back as it was. There is no permanent reduction, or there is no permanent result that you see after waxing or shaving. However, with laser, you see a permanent reduction, and you may not need to continue doing something to remove the hair after that. So, of course, laser hair reduction is completely worth it, and the best way to get rid of the unwanted hair. Fourth, are there any side effects or will something go wrong with my skin? As long as you do it with the right doctor in a clinic that uses the best hygiene practices and US FDA approved technology, laser hair reduction usually would not have any side effects. Few things you can expect after a session is mild redness, a few bumps, maybe a little irritation on the skin, but that can very well be handled using some moisturizers, some soothing applications after the laser. Of course, there's a little bit of aftercare that needs to be followed. So you may need to use a sunscreen. You may need to avoid excessive sweating for a few hours after the laser. You cannot use makeup on the face after the laser. So I'm sure the doctor you're doing it under would explain the appropriate aftercare. However, there's no major side effect. One thing you should know about laser hair reduction on the face, there's a term called as paradoxical stimulation or a paradoxical increase in the facial hair. That can happen if the hair that you worked on was not thick hair to begin with, it was fine hair, or if the laser energy used was not the right kind of energy, or the machine was not the right kind of machine. This is a serious problem, and hence it's important that you do it under strict medical supervision only. Another question asked is, am I the right candidate for laser? For body hair, most of us are right candidates. Underarms, bikini, arms, legs. These are areas which have thick dark hair, and laser would give very, very good results. Truncal hair, so back, abdomen, and even chest may have very fine, light hair, which may not respond very well to laser, and hence whether to do these areas or not depends completely upon the doctor's assessment. Facial hair, like I said, again is very individual. Thick, dark hair responds well to laser. Finer, lighter hair on the face should not be done with laser. Men also can choose to do laser. Men do full body laser. Men can also do a beard shape to have a well groomed beard at the end of the treatment. Uh, Men, of course, because of the density and the thickness of the hair, may need a few more sessions as compared to women. But yes, they will also achieve a permanent hair reduction at the end of a certain number of sessions.